I would like to thank my teacher, Dr. Chaudhary, for giving me this opportunity. He was my head when I started my journey in gastroenterology. So I will talk about vitamin E, which was discovered as a compound present in vegetables and which was essential to bear a childbirth, which was alcohol-soluble substance, and that is why it was named as tocopherol. So it is a generic term, vitamin E. It contains 8 compounds, which can be grouped in 2 series, tocopherol and tocotrienol, which differ in the presence or absence of unsaturated bond in the side chain. Each compound has a phenol ring and a side chain. Each series has 4 compounds, alpha, beta, gamma, and delta, which differ in the number and the position of methyl group in phenyl ring. Important point is that these compounds cannot be synthesized in human body, and the vitamin E requirement of our body is given by alpha tocopherol. Other 7 compounds are not contributing to give our vitamin E requirement. So these sources are obviously plant sources, primarily nuts and oils which are present. And tocotrienol, they are richly present in palm oil and rice bran oil. So these are the 2 different oils which are rich in trienol. Otherwise, tocopherol is widely present. What I want, whatever oil we take, maximum concentration of the type of vitamin in our circulation is alpha tocopherol. Why? Because all the forms of vitamin E are absorbed. After that, they are taken through chylomicrons to the liver, and through liver, they are excreted with the help of alpha tocopherol transfer protein. And this protein has high affinity for alpha tocopherol as compared to other components. And that is why most of the vitamin E circulate in our body in form of alpha tocopherol. This is the standard. We know how the fatty liver disease progresses. I will not go into its detail. How vitamin E work? It has 3 major properties: antioxidant property, anti-inflammatory property, and anti-apoptotic property. Lots of mechanisms are implicated. None of them are very well stabilized other than antioxidant property. I will not go in detail of these things. There are other minor mechanisms which are like they manipulate the membrane-bound enzymes, cell signaling, cell proliferation, gene expression which are related to cholesterol metabolism, inflammation, and cell trafficking. So just I will, a little bit detail, I will go on the antioxidant property of vitamin E. The phenol ring of vitamin E compound has an alcohol group, and that is the main compound moiety which act as antioxidant agent. All the vitamin E, all 8 type have similar antioxidant property. Some literature suggests that tricotinol have some little bit higher antioxidant property as compared to tocopherol group. But the major point which I want to emphasize here, that alpha tocopherol, they inhibit the formation of free radical, but gamma tocopherol scavenges the pre-formed oxygen radical, oxygen-related and nitrogen-related. So reactive oxygen species and reactive nitrogen species. How they work? When we have lots of fat inside the liver, they are metabolized and free radicals are produced. These free radicals react with oxygen and form peroxides. These peroxides are neutralized with vitamin E, alcohol group of vitamin E. And the vitamin E is again, which is oxidized, is reduced by the help of ascorbic acid. In absence of vitamin E, these free radicals are neutralized by polyunsaturated fatty acid, which has 1,000 times less affinity for peroxide radicals. And that is why whenever polyunsaturated fatty acids are used, they damages the membrane. And this is how vitamin E works. So how the clinical application of vitamin E, these are the 5 outcomes in which we are interested, is whether it prevents development of fatty liver, whether it normalizes the biochemical parameter, it reduces the inflammation or histology, or it reduces the risk of HCC, and overall all-cause mortality. These could be the 5 endpoints in which any study or a clinician will be interested in. We have very limited data related to animals for the risk of SCC, which I will not be talking, and we have almost a single study data which I will be coming about the overall mortality in NAFLD, but that is not NAFLD. So we have no data in two objectives, we can say. This is the single study which included data for more than 210,000 British population, a biobank population-based cohort study where the detailed dietary data was included at regular interval to see how much the data is consistent and how much vitamin E intake they are taking. So intake of different parameter was taken. Vitamin E was one of them. And the data showed that NAFLD diagnosis was reduced by 12% in those who were taking high dose of vitamin E. And based on imaging, this ratio was reduced by 24%, means MRI or ultrasound or any other modality. And overall mortality was 5.3% less in those who were taking high dose of vitamin E. But please mind, this was overall mortality in population, not in fatty liver disease. So we cannot say that high dose of vitamin E is associated with low risk of mortality. And the same thing is given here. The effect was more marked in those who had diabetes or had high BMI as compared to non-diabetic population or with normal BMI. This is the meta-analysis of 5 studies where the vitamin E was used along with the control group, and biopsy was done to assess the effect of vitamin E on severity of inflammation, fibrosis, and ballooning degeneration. And we can see that it has shown effect on enzyme and histopathology both. Serum ALT was reduced by almost 20 international unit. AST was reduced by 29 international unit, which is significantly different. And similarly, different component of liver histology was also improved, like steatosis was reduced by 0.5 unit and lobular inflammation by 0.2 unit. Hepatocellular ballooning was reduced by 0.34 unit and fibrosis by 0.23 unit. So effect of vitamin D on NAFLD, all these studies, what I have shown in the meta-analysis, were included the patients of fatty liver disease or NASH without diabetes. We have a single study which has studied the effect of vitamin E on patient with NASH with diabetes, type 2 diabetes. So this was a proof of concept double-blind placebo-controlled trial which was recently published. Included 105 patients in 3 arms and biopsy-proven NASH they had. The first group was vitamin E, 400 milligram BD plus placebo for pioglitazone. Second group was given both things, vitamin E plus pioglitazone, and third group was given placebo for both the drugs. And here we have the result we have, that the primary outcome measure was reduction of 2 point or more in NAFLD activity score, which was significantly seen in those where the pioglitazone plus vitamin E both was given as compared to vitamin E alone. And similarly, other individual component of liver inflammation markers were also reduced when the combination therapy was given. If we compare the PIVEN trial, which was the fatty liver disease, vitamin E was used along with pioglitazone in non-diabetic patient as compared to diabetic group, we can see here that the effect of pioglitazone plus vitamin E was significantly higher in diabetic group. So when the result of comparison of this slide is showing that in non-diabetic population, vitamin E alone may have effect, but in presence of diabetes, both group, a combination of vitamin E plus pioglitazone will likely to have good result. So just a last slide about coming up role of genetics, because this was the one study where they have taken data from the well-known PIVEN trial and the TONIC trial and measured the serum vitamin E level at different time interval, and shown that those who were responder to the vitamin E had low vitamin E level as compared to those who were non-responder. And this low level could be the effect of increased vitamin E metabolism, higher intrahepatic use of vitamin E, or storage of vitamin E in liver. So anything could be the factor. They have identified some genetic mutation also, which I have not gone into it. Just to complete my talk, I have enumerated the well-known side effects. So before prescribing the vitamin E, we should know the side effect. In summary, regular dietary intake of vitamin E may reduce the risk of NAFLD. Vitamin A seems to improve the serum enzyme and histological activity. Vitamin E alone may be effective in those without diabetes, but with pioglitazone it may be effective in presence of diabetes. Genetic factor might be playing a role in bringing out the effect of vitamin E in patient with NASH, and data are limited on role of vitamin E for the risk of SCC and overall mortality.